Welcome to Brainy-tainment, where we make learning a fun and engaging experience. We're your go-to portal for fascinating insights into the world around us, unraveling the complex mysteries of life in an entertaining way. We believe in the power of knowledge and the joy that comes from understanding the world we live in. Our mission is simple: to make learning accessible, enjoyable, and captivating. Now, let's delve into a topic that's as intriguing as it is commonplace. It's something that impacts millions of people around the world, yet is often shrouded in misinformation and misunderstanding. We're talking about period cramps. It's a term you've likely heard before, but what does it really mean? What's happening in the body during this time? Why does it affect some people more than others? These are just a few of the questions we'll be exploring in this video. So sit back, relax, and get ready for a journey of discovery. Today we unravel the mystery behind period cramps, a biological process experienced by many. Period cramps, also known as dysmenorrhea, are a common occurrence in menstruating individuals. This is a term you've probably heard of, but what exactly are period cramps? To put it simply, period cramps refer to the painful sensations that are felt in the lower abdomen, which can occur before and during a menstrual period. These sensations can range from a dull ache to a sharp, piercing pain, and can sometimes even radiate to the lower back and thighs. Although period cramps are a natural part of the menstrual cycle, they're not exactly what you'd describe as pleasant. But why do they occur? Well, every month the uterus prepares for a potential pregnancy by thickening its lining with extra blood and tissue. If a pregnancy doesn't occur, the uterus contracts to shed this lining. These contractions are what cause period cramps. Imagine it like this. The uterus is a muscular organ, and like any muscle in the body, when it contracts, it can cause discomfort or pain. In the case of the uterus, these contractions can cause the blood vessels to compress, temporarily cutting off the supply of oxygen to the uterus's muscle tissue. This lack of oxygen is what leads to the sensation of pain. Now, period cramps can vary greatly from person to person. Some people may experience mild discomfort, while others may have severe pain that interferes with their daily activities. And for some, period cramps may not even be a part of their menstrual experience at all. It's important to note that while period cramps can be uncomfortable, they are usually not a cause for concern. However, if your cramps are severe, or if they're accompanied by other unusual symptoms, it's always a good idea to consult with a healthcare provider. So there you have it. Period cramps, or dysmenorrhea, are a natural, albeit uncomfortable part of the menstrual cycle caused by the contractions of the uterus as it sheds its lining. Now that we've established what period cramps are, let's delve into why they happen. Period cramps are more than just a pain. They are a complex biological process involving hormones and the muscular system. Let's delve into the science behind this monthly phenomenon experienced by many people around the world. The menstrual cycle is a symphony of hormonal activity, and the chief conductor in this orchestra is the group of hormones known as prostaglandins. Prostaglandins play a crucial role in the menstrual cycle, particularly in the shedding of the uterine lining, known as the endometrium. As the menstrual cycle progresses, the levels of prostaglandins rise, triggering the uterus to contract. This contraction is a natural process, similar to what happens during labor, albeit on a smaller scale. It's these contractions that help the body to shed the uterine lining, leading to the bleeding we associate with menstruation. But how do these contractions lead to period cramps? Well, when the uterus contracts, it constricts the blood vessels that supply it. This temporary decrease in blood flow can cause the muscle tissue in the uterus to lack oxygen, a state known as hypoxia. Hypoxia can lead to discomfort and pain, which we perceive as cramps. Now, it's important to note that the levels of prostaglandins and the intensity of uterine contractions can vary from person to person. This explains why some people experience severe period cramps, while others might feel only mild discomfort or even none at all. Furthermore, the pain caused by period cramps is not limited to the lower abdomen. It can also radiate to the lower back and thighs. This is because the nerves that supply the uterus also supply these areas, leading to what we call referred pain. In addition to the pain, prostaglandins can also cause other symptoms associated with menstruation, such as nausea, vomiting, diarrhea, and fatigue. This is because prostaglandins aren't just restricted to the uterus, they can affect other parts of the body as well. So, you see, period cramps aren't just an arbitrary pain, they're a part of a complex, yet natural biological process. They are a sign that your body is working as it should, shedding the uterine lining in preparation for the next menstrual cycle. Understanding the biological process behind period cramps can help us better manage them and can also help us empathize with those who experience them. After all, knowledge is power, and the more we know about our bodies, the better equipped we are to take care of them. So, it's clear that period cramps are a result of natural processes in the body, but what can affect their severity? While period cramps are normal, the severity can vary greatly from person to person. Now let's delve into the various factors that can influence the severity of these cramps. Firstly, age plays a significant role. As a general rule of thumb, younger individuals often experience more severe cramps. This is due to the fact that their bodies are still adjusting to the hormonal changes that accompany menstruation. However, it's worth noting that as they grow older and their bodies become more accustomed to these changes, the severity of their cramps often decreases. Secondly, certain medical conditions can also contribute to more painful cramps. Conditions such as endometriosis, fibroids, or pelvic inflammatory disease can increase the severity of period cramps. If you're experiencing unusually severe cramps, it might be a good idea to consult a healthcare professional to rule out any underlying medical conditions. Moving on, lifestyle factors can also have a significant impact on the intensity of period cramps. For instance, a diet high in processed foods and low in nutrients can exacerbate cramps. On the other hand, regular physical activity has been shown to reduce the severity of cramps. It's also worth mentioning that stress can intensify period pain, so incorporating stress management techniques into your routine can be beneficial. Lastly, genetics can also play a part in determining the severity of period cramps. If your mother or grandmother experienced painful cramps, there's a chance you might as well. However, it's important to remember that genetics is just one piece of the puzzle and it doesn't necessarily dictate your experience. In conclusion, the severity of period cramps can be influenced by a variety of factors, including age, medical conditions, lifestyle choices, and genetics. By understanding these factors, you can take steps to manage your cramps more effectively. For instance, maintaining a healthy lifestyle, managing stress, and seeking medical advice when necessary can all help reduce the severity of your cramps. Understanding these factors can help individuals manage their period cramps better. And remember, no matter how severe your cramps may be, you're not alone. Millions of people around the world experience period cramps, and there are many resources out there to help you navigate this part of your life. Period cramps, while a common part of the menstrual cycle, are a complex biological process. Indeed, as we've discovered today, they're much more than a mere inconvenience. They're a testament to the intricate and fascinating dance of hormones and body functions that occur within the female body each month. We began our journey by defining period cramps, those uncomfortable, sometimes debilitating sensations that are experienced by many individuals during the menstrual cycle. We learned that these cramps, also known as dysmenorrhea, are caused by the contraction of the uterus as it expels its lining, a process driven by substances called prostaglandins. We then delved deeper into the biological process behind period cramps. We explored how the uterus, a muscular organ, contracts and relaxes, pushed by the ebb and flow of hormonal tides. This contraction, while necessary for the menstrual cycle, can temporarily cut off oxygen to the uterus, causing the pain commonly associated with period cramps. And of course, we examined the factors that can affect the severity of these cramps. We discussed how age, lifestyle, medical history, and even stress levels can influence the intensity of dysmenorrhea. We learned that while period cramps are a common experience, they are far from uniform, varying greatly from person to person. In conclusion, period cramps are a testament to the complexities of the human body and its functions. They remind us that our bodies are not just vessels, but intricate systems, capable of amazing processes and feats. They are a call to understand more, to delve deeper, to continue to explore the wonders of our own biology. And with that, we wrap up our discussion on period cramps. It's been a complex but fascinating journey, and we hope it's been as enlightening for you as it has been for us. Thank you for joining us on Braintainment. Remember to subscribe for more insightful content. Stay curious and keep learning.